This webinar is a very exciting one, Advancing PKD Care in Today's Society. Dr. Mike Bevilacqua is a nephrologist with additional training in health administration and divides his time between clinical medicine and nephrology administration. His clinical nephrology practice is based in Surrey, British Columbia, and he is involved in several administrative roles with BC Renal. He is the chair of the Kidney Care Committee, which oversees the care of over 15,000 British Columbians living with chronic kidney disease, and he is also the medical lead for the BC Polycystic Kidney Disease Network, which aims to optimize management of PKD in British Columbia. It's a lot to take on, but he always finds time to join us and to help the PKD community, and for that I'm eternally grateful. Without further ado, I'd like to welcome Dr. Bevilacqua.
Thanks so much, Jeff. It's always hard to sit there and listen to someone read out your bio. You're kind, but thank you for that. In BC, the way it's set up is we have this group called BC Renal. It used to be called BC Renal Agency. Now it's just BC Renal because that's trendier. But at any rate, we're the organization that is responsible for the coordination of all kidney care across the province. So that means things like our chronic kidney disease clinics, dialysis treatments, medications, all of the kidney care. The one group it doesn't include is transplant, which falls under BC Transplant, but otherwise it coordinates the rest of the care. Now, and you can see it's a large number of people here. We have many thousands in our kidney clinics, which is my other job. We have over 15 now, actually up to 16,000 patients registered. Now, the way that care is delivered, though, is it's what we call coordinated centrally, but delivered locally. And what that means is us involved with BC Renal, what we do is we set kind of care pathways, we develop some of the infrastructures and some of the tools that clinics use, but the local clinics are the ones who are actually the ones delivering the day-to-day care. We have in British Columbia what we call health authorities. You can see here this one that says 6 health authorities. Those are the little areas that are geographical, split up so that they can best deliver the care locally, which I think is a good model because then you understand the local needs. But the important thing is that we're not directly one body that is implementing or directly running the clinics. We kind of say we think you should do it in this way, and then there's some flexibility to each clinic to kind of adapt that to their local needs. It seems like I'm splitting hairs, but it is important to understand that when we're talking about having a provincial scope thing, it's not like it's one body of clinics that I can just dictate what's going to happen. We have to involve all of these various health authorities and make sure that these things work in all of those areas. We don't want to do something that just works in Vancouver or the Lower Mainland, but doesn't work in the North, for example. It has to have that provincial scope and be modifiable so that every group can make something work. And then to make it even more complex, what we say is that, so BC Renal that I just talked about does all kidney care. Well, that's all of our, health authority run kidney care. So this includes our chronic kidney disease clinics, our dialysis programs and things like that. But we also have nephrologists who we all work independently as well. So all of us run our own individual offices, and that's, for example, where we would meet somebody the first time, and some of our patients might not go on to be into the kidney care clinic. So there's also a group of kidney care providers that work a little bit outside of BC Renal to add yet another layer of complexity. So this is our BC Renal website, it's just bcrenal.ca if you want to go poke around. To orient yourself, if you're going up there, you'll see that there are health info and health professionals. This is the health professionals tab, but the health info, which I'll show in a second, is the patient-specific things. We basically train people up to get there, to have the right tools and to have the right education. And you can see this, there's a lot of stuff there. It's not just that best practice document what I showed you here, but under each of these tabs, there's a whole bunch of stuff, right? Dietary things, blood pressure, what kind of medications to use, even as simple as forms that we use in the clinic when people come to see. There's one called a learning needs questionnaire. That was that point about when you come into the clinic, you tell me what you need, and we'll make sure that we work around it. There's a whole host of tools that we had to develop to support those best practices. Again, we don't just want to hand someone something and say, go do it. We want to put the tools in their hands so that they can. We went out of our way to maximize what people could do for imaging. So one of the cornerstones, again, I'll defer you to the previous talks about how all these things work, but one of the main items, one of the most important things in polycystic disease care is imaging of the kidneys and using that to determine what's going on with the disease. And so one of the things that we heard is, well, a lot of this relies on MRI, but we don't have access to that in our part of the province. So, are there ways that people can do other items? And we talked about CT scan. Without getting too much into the details, the difference between an MRI and a CT scan is to do a CT scan, it's like an X-ray. So it has a small amount of radiation that goes along with it, but it still has some, whereas an MRI doesn't. So that was always a worry of, well, you don't want to keep just CT scanning people over and over again. We don't want our patients to be glowing in the dark by the time they're done with them. We want to limit the amount of radiation we're doing. So we actually came up in BC with what we call our ultra low dose protocol. So the UBC ultra low dose protocol for a kidney measurement with CT scan that actually get that radiation down to, it's about the same as getting an X-ray done. Whereas before it would be, 10 times that amount. So we were able to really, really minimize this. And the goal, it might sound kind of academic, but the goal for that is to say, well, actually, now if you're in a place in the province that doesn't have an MRI scanner, you can do this with a CT and not have to worry about giving a lot of radiation to the patient to do it. So again, enabling people to use what they have in their local area rather than having to travel 8 hours to come get an MRI. And then in addition to the tools we have for the clinicians, we have a whole bunch of things for people living with the disease. And these are the ones I really want to encourage everybody to go and look on our website and pull them up. We put a lot of work into these and I hope that they're useful to people. So if you go on that health info tab, I was looking at this like it's a button, but it's a PowerPoint slide. If you go on the health info tab, there's things like, you can learn about the disease itself. Actually, when you go there, it puts you over to the PKD Foundation website because that's where the best source of information is. And then if you go into the managing, you'll see some of these things we developed, like what about dietary things? What should I be doing with my diet? There's a couple of other tools that will come to in a second, some items around treatment with the medication told out. So information specifically for the patients, everything that we develop for the staff, our goal was to come up with a mirror image one for the patient to read themselves. And then the two complement each other. And then we were fortunate enough to be working with the great group like we have here on the call with the PKD Foundation and the Kidney Foundation as well, where we actually collaborated to make some of these resources together. And the ones we took on were things like chronic pain management or pain management in polycystic disease, family planning and pregnancy, and screening or testing of asymptomatic family members. And the reasons we took these on was there wasn't a lot of great information actually out there. One of the reasons, especially for something like chronic pain, I'll be blunt about it. One of the reasons that there wasn't a lot of great information about there is because it's a hard subject. It's a very hard topic to come up with recommendations for. But our kind of goal, and I'm so glad to have the PKD Foundation and the Kidney Foundation too, who agreed with this, was to say, well, just because it's hard doesn't mean we shouldn't do it. And we just kind of jumped into it headlong and took it on and came up with some resources. So I'm super happy, and these are up on the website now that everybody can take a look at.